Communication is really the first and most important thing to think about when a health crisis emerges, because people are scared. And there's not immediately an understanding of what's happening, or how severe is the risk, or how do I protect myself from that. Hi, I'm Dena Morris. I am a member of Amplio's governing board. I led the Washington, D.C. office for the Centers for Disease Control and Prevention before coming to Seattle. I think the Talking Book can be a really effective tool, particularly in responding to a public health crisis. We're able to fill that communications need very quickly and very effectively. We can load the Talking Book with basic information, specialized, localized information. And we can do that in a way that amplifies the credibility of the people who are speaking.
You know, COVID came as a pandemic, and Ghana was really not very prepared for it. We needed to reach out to many more people. So that was when we realized that the Talking Book was needed critically to make sure that messages on COVID, especially issues about the signs and symptoms, what to see in an individual and to know that, or to suspect COVID, and also talking about stigmatization, talking about where to seek help, and all the other things that we needed to talk to people about.
It has helped us in reaching a lot of people. Since COVID-19 came, it was actually a headache and stressful for us to go into the communities to organize their best and speak to a large number of people. But since this Talking Book came into existence, it has helped us anywhere we go and we gather people. We just play it for them to hear what COVID-19 is all about.
Why you Dena? I let me don't get my unique. Let me take a jill. It's a book, a bunya and vietare. Marty Yarabara. No me ye about Chakaya but Yarele. So Bawa Chakale back Yare.
And we can get that message out in a place where there are not great transportation infrastructure options available. It's a low-tech tool, so it doesn't rely on stable electricity or internet service or satellite service. The Talking Book device is a very helpful tool, and it plays into the strength of local leadership. The messages that are played most frequently and replayed are those that were recorded by faith leaders, tribal leaders, health leaders, people that are known and respected and bring credibility to the work.
The Talking Book have actually helped in addressing language barriers because most of the nurses are unable to express themselves in the local language.
It is context specific. It is made to suit the community. It is a language that the community members understand.
What we'd like to do is to affect behavior change without a public health crisis.
We are looking at issues of malaria. People still do not believe that malaria can cause a lot of deaths, and children die every minute. Talking about tuberculosis, polio. I mean, we thought we were done with polio.
We actually want this Talking Book to stay with us, but we believe that if we can add as maternal health issues, child health issues like malaria, prevention of anemia, postnatal, all these key messages, if they are added, we would have been grateful for that.
What we'd like to be able to do is take the wealth of knowledge that we have about how to prevent disease, how to prevent injury, and bring that to people in a way that persuades them to do things that are more likely to bring them a safer, healthier, more productive life.